Hey guys, my name's Sam and welcome to Paramedic. This week's video is part 2 in a 3-part series where I am redesigning my first line gear that I use as a SWAT paramedic. If you have not already seen the video I did last week that covers my third line gear, so everything I have in my backpack, go take a look at that. I'll leave a link up here. I can never remember which side it comes up on. But this week's video is a continuation of that. So I'm going through and trying to re-tier my kit to make sure that my first line gear, what's on my belt, my second line gear, what's on my vest, and my third line gear, what's in my backpack, all coincide and work well together. So I've kind of slimmed down each of these packs, redesigned how I function. And if you're new to this channel, just know that I go through my gear all the time to try to optimize it. I'll have a call where something doesn't go right or I can't find something. And I'm really just trying to hone in on the perfect setup for me. I highly doubt I will ever get there. So this kit right here is what I'm gonna be wearing on my waist. Now we change armor all the time. So sometimes we are wearing our big stuff like I have back here. That's for the majority of our call-outs, but I also have a plate carrier I throw on. And I do change the placards, but what I found is if I'm keeping too much gear on my vests, I end up forgetting it when I change over to something else and I don't have something when I need it. It's not in the right place. So I've really transitioned to carrying most of what I need in my belt with a couple supplementary items on my vest and then all of the big stuff in my backpack. This belt right here, this is all built around the Paramedic hybrid IFAK. So I've been a fan of these guys for a long time. Nothing in this video is sponsored. I paid for everything on this kit with my own money. And yes, we do get issued equipment for our tactical medic team. However, I kind of choose to upgrade it because what we're issued is not always the top of the line stuff. So right here we have the hybrid IFAK, and that has 2 wings that come off it that allow you to molly things to it. So starting in the middle, I have a roll of tape that I have just tied onto one of the loops. One thing I wish about this IFAK is that it had some molly webbing or something that I could actually attach some stuff to the outside. But this works just fine. The risk here is that it could get hung up on something when I'm going to stand up because obviously this is a fanny pack. Coming into the front pocket, we have a pocket completely dedicated to PPE. So in here, I've got some gloves, I've got an N95, and then I have a plain surgical mask. So I do have this labeled as a bleed kit. And one thing I should mention about this whole kit is this is designed to fit with or without a battle belt. So if I have my normal loadout, I can just take my belt, put it on, and then I throw this on as well. I can swing it around without actually adjusting my belt. I don't have to take anything out of Velcro, unclip it, reclip it really easily. So this can be used with a variety of different setups. Coming into the main pocket here, we have basically the contents of an IFAK. So what I really like about this kit is that it allows you to change up where the bungee cords are to fit whatever kind of equipment you're carrying. So I've seen a ton of different layouts. This is what works for me. I've kind of changed it around. But in this first one, I have a North American Rescue 4-inch trauma dressing. This is just a compression bandage to be used on non-life-threatening bleeding on the arms, legs, wrap in wound pack, wrap around somebody's head if they're hit there. It's a very versatile piece of gear and probably will be used way more than any of the packing gauze. So next to it, I have packing gauze. So on the top, I've got a thing of quick clot combat gauze. This is just 4 yards of hemostatic agent. Now, while your hemostatic agent is really important, I also am carrying just a plain thing of North American Rescue S-rolled gauze. This stuff is like $2 and it works almost as well as this right here. So I have both of them on here. If the need arises, I can actually take this, pair it with the elastic wrap I have here. There's nothing special about this. It's just a piece of elastic that you can wrap something really tight. I can put this on it, I can make a compression bandage, I can pack a wound with this if there's multiple bullet holes. We're trying to facilitate stopping that bleeding, but it all kind of works together. Now, down below, I have 2 nasopharyngeal airways. I'd like to change these out with pre-lubed Nasopharyngeal airways, as it stands, I have lubrication taped to the back of both these, and these are both 28 French. Now, on my last video, people were calling me out. They're like, oh man, you forgot an oral pharyngeal airway. I'm really not using oral pharyngeal airways in this setting hardly at all. What I've found is if we're putting in an NPA, we're probably going to move to a more advanced airway at some point. This works just as well. The old contraindications of don't do it if they have any kind of facial injury are kind of out the window because nobody's actually inserted one of these into the brain. That was actually done with NG tubes, which are much, much smaller. So obviously use common sense. Don't be putting this in somebody that you can see brain matter coming out their nose. But most of the time, even in trauma, these are going to work just fine for you. So I have 2 of those. I can use them on multiple casualties, or I can take that and I can throw one in each nair to just really open up that airway for somebody as I'm moving them. In the lid of this kit, down below, I have 2 eye shields. So this is another way that this elastic rack might come in useful. I can wrap these on somebody. We're not really wrapping both eyes if one eye is injured, but I like having 2 because we all have 2 eyes. I have 2 ARS needles. One of these is a 10 gauge, one of these is a 14 gauge. If you have the resources, just get 10 gauge needles. They're gonna work a little bit better for you. But there's nothing wrong with the 14 gauge if that's what you had. I had these laying around, so I threw them in here. And then next to that, I have just a survival blanket. This is really generic. We want to keep people warm. I have a much larger heated blanket in my 3rd line gear that I went through last week. So you can check that out. This is just going to supplement that. I can actually cocoon them after I put them in that ready heat wrap. I can cocoon them in this and help some of that radiant heat loss. And then last but not least up here, I just have a twin pack of chest seals. Might throw another one of these in there. Had some halo seals in there because that's what we're issued. But I like these vents a little bit better in that. So this all fits in here. Now keep in mind, while it doesn't fit really well together while this is just flat, but if it's actually around your waist, it conforms a little bit better and you can get to these zippers easier. The last thing on here, it's not really like a necessary item, but I've found that I always lose it during briefing when I'm trying to write down information on the call or do my drug calcs ahead of time. I just have a Write and Rain a notepad and a pen that just slides right in here, so I always have one on me and I'm never missing it, because the last thing you want to do is forget what the address is or what your route is, or not be able to do your drug calculations. Coming over to the right side, this is a Paramedic medium bleeder pouch that I mollied in there. It has a lot of the same concepts as the big one. You can kind of customize it, which is why I got it. And I've got a number of things in here. I'm also going to change this up a little bit based on some of your recommendations from Instagram. So in here, I have a headlamp. Light is king, especially when you're doing a cricothyrotomy, which is what this kit is dedicated for. So I want to make sure I always have something on me that I can light up that scene or that situation. If I'm in a hurry, I forgot to put on the light on my helmet, I at least know I always have this in here. Now, one of my subscribers said that this Princeton tack light doesn't work super well and that it has some battery drain issues. You know, I haven't had an issue with it. I'll probably replace that with a black diamond light at some point. Now, on the inside of the kit, I've got a number of things. So I've got the 10cc syringe, and this is everything you need to do a cricothyrotomy. I have a cric tube with a bougie introducer from North American Rescue. I love these things. I've got like a million of them in all of my kits because they're so small, really convenient for your cricothyrotomy. And then I have a scalpel in there as well. So that's everything you need to do the actual incision. Down here, I've got a Sharpie to do any number of things, might not even be related to the cric. I have a pair of hemostats that I'm going to change out for some, I think they're called curved peen hemostats that we use for like our finger thoracostomies and stuff. So I'll put that in here. Right now, this can help you with a cricothyrotomy if you absolutely need to. You can use this to kind of spread if you're having some issues. Grip things. I've really found a ton of uses for hemostats, even if that's turning a blood pressure cuff into a makeshift tourniquet, clamping off the hose going to it. You can make a really effective tourniquet with that. So I like carrying hemostats wherever I go. And last but not least, this is just a tube securing device. It's tape that's pre-cut that goes around the crike tube to hold it in, because the last thing you want to do is crike a poor guy and then pull that cricothyrotomy right out and have to start again or find the hole you just made. So I like making sure I have something to secure them. Obviously, I could do that with this tape over here, you know, you name it, but it's just a little bit more convenient, especially when I'm stressed out. So all of that goes in here. The last thing I would love to add that we were talking about last week is an EMA device from Massimo for your capnography. I'll probably put a colorimetric device in here when I get a chance to grab one from the hospital. If you know anybody at Massimo that wants to send me an EMA device, I love it. For those of you that don't know, that's a capnography device that can be used for just monitoring a normal patient that's talking, walking, breathing, or it can be used to confirm tube placement in your criked patient. It's a really good indicator if somebody's gonna need a massive transfusion. I recommend everybody go on waveform capnography if at all possible. I put it on a ton of my patients because we have it hooked up to the monitor. But that is one thing I would add in here, and I'd probably end up changing some stuff around. So that's all in this kit. Maybe I can get a little thing that says crike or surgical kit in there at some point, but right now I don't have any patches made. And you might notice some of this stuff is like reused from other things. I've got a ton of stuff laying around the house, so I like going through and just reusing things in different ways because it really helps me optimize everything I have. So on this side, we have the tourniquet holder from Blue Force Gear. This pops down, have one cat tourniquet. So I've got one cat tourniquet on here. I have one in my backpack, and I'll probably throw one or two on my plate carrier. So total of 4 tourniquets. You don't need a ton. I'm not building this kit out to be a mass casualty kit. A lot of shooter kits have like a million tourniquets, and that's really not what my job is in these situations. So I'm not carrying a million tourniquets, but I have enough, one for each extremity. And then last but not least, on this side, we have a flashlight. So this is the Fenix Lights LD30. They gave us a couple of these, outfitted the entire team. Super, super bright flashlight. I think it's like 1,000 lumens. I like it because it's got a battery indicator on one side, so you can actually see that green light as you turn it off and on. You can change modes on it pretty easily, but it's not all on the end cap. So when I turn it on, it'll come on at whatever setting I have. And why I have this in here as well as a headlamp is this can be used for when we get to a safe zone, something like that. I can take it and I can just set this on the ground, and it's gonna light up a really large area, kind of like a lantern. So super, super useful in that regard. I am carrying this light in a high-speed gear taco covered pouch. I like having it covered, especially if I'm just dragging this everywhere. It's not gonna fall out or anything. It's also not like a really quick need to get it now item. So that's everything I'm keeping on this belt. Somebody's gonna mention trauma shears, I'm sure. I'm probably gonna carry those on my vest or figure out some way to attach them on here. I really haven't figured that one out. Obviously something that you need in a hurry, so I might just keep that on my vest front and center, can pull them out, start cutting things to identify injury sites. Let me know in the comments down below what you think I should get rid of or add to this kit, and I will see you next week.